Another newer modality that we have been seeing these days is tumor treatment fields. The research for these tumor treatment fields has been happening since very long, like around 2003, 2004. And small pilot studies have been started, and they have been evolved now that even FDA has approved for its use in the glioblastoma patients as an adjuvant part. And nowadays we are also seeing how to utilize it in the combination with the adjuvant chemotherapy after surgery. So what are the advantages of tumor treatment fields? Because of the glioblastoma being so aggressive tumor, even after surgery and after radiation, we have to keep the patient on the adjuvant temozolomide or oral chemotherapy. But most of the times, 50% of patients may be able to stabilize it or improve, and 50% of patients may start again progressing on that. So after that, initially we don't have any more options to treat such patients. Then these tumor treatment fields have been evolved and has shown promising results to control its progression or to even improve the situation. And the better part is it won't affect any other normal brain tissues, because it only affects tissues which are dividing. As such, our brain normal cells are not dividing cells. They won't have any effect because of the tumor treatment fields. And from 2015, it has been approved to use in glioblastoma. Nowadays, we are also able to find its use in pancreatic cancers, oral cancers, also ovarian cancers. So with addition of tumor treatment fields, progression-free survival can be increased from 4 months to 7 months in glioblastoma. And if you are combining it with adjuvant temozolomide, it has been found to increase up to 20 months. So now the trials are being aggressively done to see how really effective it is, and what extra benefit is going to give in the brain cancer patients. So this is one more newer method of having adjuvant therapies for brain cancers. So how does this tumor treatment fields affect? With tumor treatment fields, it gives, I will show you the picture. See, you can see in this picture, there is a swimming cap like structure with number of electrodes that has been pasted. They are similar to the ECG electrodes which you use to take a regular ECG. And these electrode patches will be applied onto the clear screen of the brain, and it generates regular pulsating electric fields. And with this, there will be a disruption in the mitotic of the cell divisions. And so with these disruptions, the cell will not be able to clearly divide, and thereby it dies off, or it will be in that stage forever. So this way, there is a chance that you are able to stabilize or control the growth of the tumor. And the role of chemotherapy, immunotherapy, and target therapy in brain as such initially was very limited, and we generally utilize these services only when the regular mainstream standard treatments have been exhausted, like in brain cancers like glioblastoma. If after radiation, after surgery, there might be a progression, so we'd like to add chemotherapy so that we can contain it. And the better tolerated drugs are temozolomide, and the compliance of it is very good because of its availability as a oral tablet. So instead of giving injections every day or 3 weekly with lomustine, carmustine, irinotecan, etc., uh, this is a well tolerable chemotherapy agent, and the side effects are also very less compared to the injection based chemotherapy like lomustine, carmustine, irinotecan, etc. So in target therapy is recently being tried in brain tumors, and still we are in trials, not as a standard yet. And the promising drug that we have seen is the everolimus, which has been being tried in the trials also. And another promising agent that we have been already using is the bevacizumab. It is an anti-angiogenic drug. So sometimes even after radiation, there might be progression in brain tumors. Then we will be able to utilize PCV-based chemotherapy or bevacizumab, so that it can be able to uh, prolong the tumor progression or delay its progression. and also it has a good effect on decreasing the edema in the brain. And another thing is the immunotherapy. Nivolumab, pembrolizumab, ipilimumab. These three drugs have been being tried experimentally for brain tumors, and still we need to wait and watch for how much benefit they can cause. So these are all the ways how we can treat brain tumors. The primary being surgery or radiation, depending upon its resectability as well as the location. And the other thing is systemic therapy. And the promising new innovation that is being tried is the tumor treatment fields.